All right, if you scoot just a little bit over. Perfect.
Good.
Well, hello, you lovely humans. Thank you for tuning in. Thank you for being here. You can tell I have a very special guest here. The one and only Dr. Moira is here with us. But it's Wednesday, it's 7 o'clock. It's time for our Wednesday weekly workshop. And as always, it's Ask Me Anything. But if you saw my post from, I think that was yesterday, this week, it's not technically Ask Me Anything, it's Ask Us Anything. So, Dr. Moira, we're thrilled to have you here.
Yes, thank you for having me. Absolutely.
November was the last time, or the first time, that you were on Instagram with us.
Yes.
Now there's a whole set of videos on our YouTube with you. This is your first YouTube live with us also.
Yes, exactly.
Cool. So start to rattle off those questions. The incomparable Two Boots, Lori LeClaire, will be here in just a moment. But I actually have a question to get started.
Yeah, please.
Something I've seen you do on your Instagram a bunch is is it like every week maybe?
It's like a weekly recap. Yeah.
Yeah. You'll say, this week I saw this, I worked on that. What'd you work on this week?
So this week was pretty fun. It's only Wednesday, but I got to work on feet, so plantar fasciitis in particular.
Okay.
I swear things come in waves, so I wonder if that happens with you too. But I got a couple of patients that I'm working on foot issues with. I saw a new patient with some hip trouble today. Radiating nerve pain down the arm, kind of into the finger. Yeah.
I'm starting to get really good questions.
Yes.
Okay. So you said plantar fasciitis.
Yes.
And then arm nerve.
Yeah.
Okay.
Radiating, exactly.
Okay.
Hip stuff was on there too. My bread and butter, neck and low back pain and tightness, stiffness, achiness, all that kind of stuff.
Okay.
And worked on a couple headaches this week too so far.
Ooh, okay. So we're definitely going to talk about headaches because headaches is something I see a lot.
Yep, same.
Okay. All right. So first thing, plantar fasciitis.
Yes.
All right. So for people who don't know, that's an issue with the bottom of the foot, right?
Correct.
And there's usually pain involved.
Yes, definitely.
Okay. I see a certain set of things on hair analysis with those people.
Interesting.
So I want to talk about that.
Yeah.
But then I want to hear the stuff that you are seeing.
I love it. Let's do a compare contrast.
Yeah. So I'm just really curious. So what are you usually seeing when that's coming up?
So first, you're allowed to have pain in your foot that is not plantar fasciitis. So I think people come in and they have foot pain in general, and that's the name that they hear associated with foot pain. So plantar fasciitis typically is right at so if this is your foot, this is the heel, these are your toes.
Yeah.
The pain is right in the center here or just off to the inside. It tends to be worse first thing in the morning when you wake up. Or after you've been sitting for a while and then go to stand. Those first few steps can be pretty rough. It can also be just like uncomfortable all throughout the day if it's pretty intense. But those are kind of some of when people tell me like morning is sucky, it's in that specific location.
Yeah.
That kind of stuff is really like starting to ring the bell of this smells like plantar fasciitis.
Gotcha.
Yeah.
So what's the stuff you're trying to accomplish to get that to stop?
Yes. So I'm looking at areas outside of just that heel where patients are having pain.
Yeah.
A big place that I look at is calf. If there's calf or hamstring tightness, that everything in our body is connected, right? But especially with foot issues, you want to look upstream. So I'm looking at that. I'm also looking at muscles that are in the arch of our foot.
Yeah.
So I'm checking muscle tightness in general in the system as well. I'm also checking to see what their balance is like, if they have any joint restrictions in their foot, ankle, knee, hip, low back, all that kind of stuff. Yeah. Mm-hmm. And the other thing too is, can they do two things? Can they spread their toes apart? Do they have control in the muscles of their foot? Yeah, exactly.
All right.
Can they spread toes apart? And then the other one that's a good test too. So again, if this is your foot, this is your big toe, these are your little ones. Can you lift and raise your big toe separate from your little toes? And then can you lift and raise all your little toes together separate from your big toe?
Question, do I get to drive my big toe into the ground to get the little toes?
Yes, you can.
Cool.
Yeah.
And I'm good. Because I was like, please tell me I can anchor that.
Our feet, we should be we should have strong muscles there. We should have mobility there. We should be able to do those tasks. That tells me that the health of the muscles in your foot and control of it is good. So that's typically exercises that I'm sending out plantar fasciitis patients if they're lacking in that.
Okay. When you said muscle tightness and you were talking about different areas influencing it,
Yep.
that's what hit home for me.
Yes.
So what I see all the time when we're dealing with this is that, and I'm going to start to invade your space.
Yeah, go for it.
So on the hair analysis or hair tissue mineral analysis, we see an imbalance in the mineral that's called manganese.
Ooh.
Okay. Now, here's what y'all need to understand about manganese. Rubber bands. What happens when you have a fresh rubber band and you stretch it and you let go of it? Snaps back into place, right? It goes right back to where it's supposed to go. Manganese is what keeps a lot of the connective tissue in your body, things like tendons and ligaments and muscles, fresh rubber band-like. So when people have an imbalance on that mineral, their body's ability to get stretched into a different shape or to deal with the stress of standing, walking, whatever all night, it doesn't go back to that ideal form. Did I hear you say it's usually worse in the morning?
Yes.
So I've seen that also because overnight, that body wanted to go back to its ideal shape, but it couldn't rubber band its way there. So all night it was in a stressful state instead of going to this ideal.
Yep, exactly.
And then wake up with it.
Yes. I'm just thinking the image of like those crusty rubber bands that you pull out of your junk drawer.
Yep.
And then they snap, they crumble, whatever. That makes a lot of sense. And I will get a marker too, just to show a visual of like the hammies into the calf and how that attaches into the foot. So if this is our knee, this is our ankle, these are our toes here. This is calf, and then around the ankle, it runs all the way down. So right in this zone here is where that rubber band issue that Drew's talking about, like that's where you feel it. So this is really a lever system here. So if those rubber bands are not functioning well, you're going to start to feel discomfort like in those areas.
That's the catch point. That's why it hits us there.
Yes, exactly. Ankle, knee.
Yeah, gotcha.
Yes.
I don't know if we've ever had as good of an explanation of plantar fasciitis as we just had now. I think it's come up in one of the live streams before, but never with that kind of depth. Awesome.
Cool.
Tubits, did any questions roll in? No, cool. Okay, let's go to the next one.
All right.
The arm nerve.
Yes.
Let's erase 2. Do you remember what arm it was?
It was this patient's left arm.
Okay. So I see nerve pain in arms. It is way more likely to be in the left arm.
Interesting. I find it to be in at least the patients that I'm seeing in their dominant side.
Ah, okay.
So this is interesting to compare here.
Yeah. All right, so you're saying, this would be really cute. You have the red marker. You write what happens for you.
Okay.
I'll be the blue marker. I'll write what happens for me in blue. So dominant side is more common. For me, it's the left side.
Okay.
All right, so tell us about this person.
So this patient came in, she was dealing with tension headaches, neck tightness, upper trap tightness already. Okay. And then we were working on that. Her headaches were pretty much done and gone with, but the tightness like takes a while. It's not a magic like one fix and done, even though I wish that's how our bodies worked. Yes. So it started to manifest like down her arm. So there's 3 main nerves in your upper arm that go down to your hand. So ulnar is the one where if you hit your funny bone and it shoots down, zings your fingers, it's pinky and ring finger. That's the distribution that she was getting that in, which I would say is most common for this condition that she had, which is called TOS, thoracic outlet syndrome, which just means you're getting compression in this area here, upper trap tightness, like everything that she already was having. And nerves don't like tension and they don't like to be compressed. So likely she was getting one or both of those, and then she was getting like tingling irritation down her
Gotcha.
pinky into her ring finger.
Okay. What are the other two nerves that are in the arm?
Then the other one is median nerve. That'll usually be thumb, pointer finger, and half of middle finger. And then radial nerve, and that tends to be more like in the forearm. Yes, like on the thumb side forearm.
Yeah.
Yeah.
Okay, cool.
There's many more nerves in your arm and your hand, but like those are the, I would say those are the main ones.
Yeah, totally.
Those are the big guys.
So you said in there that if a nerve is under pressure, that it's going to get unhappy.
Yes.
So are you trying to find the spot further up the chain?
Yes.
So it doesn't talk down the arm?
Exactly. So I kind of tell patients, it's like they're like noodles in your body, right?
Yeah.
They don't, again, tension, they don't like the rubber band. They don't like to be tension like that. And they don't like to be mushed or compressed.
Yeah.
And that's where you'll start to get nerve irritation. And those are words that are, when I hear patients say words like burning, numbness, tingling, shooting pain,
Yep.
that's ringing my bell that that's like a nerve issue
thing.
going on.
Not the dull pain.
Correct.
Right? Not the throb.
The dull, sore, icky throb is usually not nerve.
Different. Okay.
Yeah, but to answer your original question, that nerve can get irritated anywhere along the chain, where it lives, right? So it exits your spine and your neck, goes all the way down to your fingers. Yeah.
So I love that you said that. So would you jot starts at that nerve starts
Yes.
at neck, like upper back neck, you said?
Yep. This is for ulnar.
Yeah. Okay, because what I see again and again is that these people who are having this, they are dealing with thyroid issues.
Interesting.
So
yeah.
For those of you who don't know, could you do a side profile of a spine, even if it's just a squiggle?
Yes. Yeah. So we'll have head here, and then it's gonna be ideally like this, and then that's it.
That's perfect.
Yep. Okay.
So the neck is right up here, okay, because that's our friend's face.
Yes.
Okay. Let's do like the most crude. He's kind of small. It's a bird human. There you go. Just so in case anybody's wondering, that is exactly what your innards look like. I know.
The textbook version of a spine drawing. I just don't know if I can get any better, people. Okay.
We're gonna get canceled.
Yeah.
So the nerves that are in the spine, up at the neck, control things like shoulders, arms, but they also control thyroid.
Yes.
So what I've seen again and again is that when people are having this nerve pain in their left arm, is that their thyroid is upset about something or needs some kind of nourishment or support. Now, the thyroid is in front of the spine, okay? Correct me if I'm wrong, because this is totally your wheelhouse. The nerves in the thyroid talk back to the spine, and the spine nerves talk forward to the thyroid.
And that's anything in your body, organs,
Thank you.
Like muscles. It's a two-way communication stream. Yes.
So it's the chicken and the egg.
Yes, exactly.
Okay, cool.
Yeah.
And I think that's why we're looking at the same thing.
Yes.
But I'm like, oh, it starts in the neck. And I'm like, well, I don't do alignments and adjustments, but I nourish organs that would be on the same nerve as.
And I have one thing, since you brought up thyroid.
Yeah.
What I typically, the first thought instead of this, so a patient will come in, it's typically like, it's typically female in like 50s, 60s, and she's got frozen shoulder and doesn't know why or how it started, which is most frozen shoulder. It like pops up, just randomly. The first thought is to check thyroid.
Oh yeah, and parathyroid.
Yes.
Because they dictate where calcium goes, and if you have too much calcium collected in a joint, you can get things like spurs or frozen shoulder because it changes the pH in there.
Yes.
For those of you who don't know frozen shoulder, it sounds like exactly what it is. You go to lift your arm and it just stops at some point. It's just stuck.
Yep.
It's frozen.
Yes. So I don't know if that's like menopausal, like impeding on thyroid. It's interesting, but long story short, like there are physical, almost muscle joint presentations where the source of the issue is it's not that tissue. It is organ or nutrition or hormone, whatever, that kind of stuff. So it's kind of cool.
Yeah, I think we're seeing the same coin on two different sides.
Yes.
Very cool.
Yep.
Lori, did any arm nerve.
No questions on that?
And we're going to keep rolling because we have a great list. She's been busy this week. I don't know if you knew that. Let's erase.
Yes.
All right, so we did arm nerve. Ooh, hips. Okay. Cool. Yeah. The next two after that, I got all sorts of 15,000 ideas.
Yes.
All right. So hips. Why don't you throw hips up here for us? What were you seeing? Because I think hips are notoriously simplified.
Yes.
Like hips can do crazy stuff that other joints can't do.
Yeah. And I should start out, that's a good lead into patients coming and say, my hip's killing me. Where?
Because like it could be back here, it could be out here, it could be in here, it could be up here.
Exactly.
There's a lot going on.
There is a lot going on. So when I have patients point to almost like their groin or the very front of the hip, I'm thinking either hip flexor issue or like the hip joint itself.
Yeah.
When someone points to the side here, again, I'm thinking hip joint or a little muscle that lives on the top of your IT band that can get irritated. If someone points to like the back of their hip, I'm actually thinking more SI joint. So like your pelvis, glutes, low back referral. So you're right. I get a lot of like hip when we kind of need to dive in and ask like, where is it actually your hip joint or is it just an area kind of circling around the hip?
You have to get specific.
Yes, exactly.
There's a lot going on.
Yes. Yep.
Okay.
Completely.
Okay. So what I've been told again and again with hip flexors is often it's because the opposite side of the body needs strengthening.
Interesting. Yeah. That's not entirely off.
Okay.
And I would say hip flexors typically get tight as a compensation to something else.
Okay.
Muscles don't just like get tight to get tight. They are trying to lock you down and stabilize. So that's when you start to feel the muscle discomfort and why it's important to look at areas other than where patients are having pain symptoms at.
Yeah.
Yes. Yep.
Interesting.
Mm-hmm.
Okay. I see a ton of stuff with intestines and bladder when it comes up. And that goes back to our two-way street thing.
Yes.
So for me, hips often don't act up. Intestines and bladders usually act up.
Interesting. And that makes sense. They're all in like similar areas, similar referral like spots too.
I think a lot about inside of our abdomen, there's a finite amount of space.
Yes.
And if an intestine or a section of the intestines is inflamed enough, it's pressing on things and pushing out in a way that isn't ideal.
Yep.
And I'm wondering if that is pushing on a connective tissue.
Yeah.
Stimulating that pain response.
The other thing too that I'll see is like posture.
Yeah.
So if I have, especially women come in with the, it's like the butt out and then it's the like overarched low back basically. That is like just constantly shortening up those hip flexors and over compressing that low back spine.
Gotcha.
So same thing, then there's only a finite amount of room and then it's more pressure. So I'm going over posture and like breathing mechanics too with hip patients a lot.
So for that exaggerated, bottom side out, what are you doing to counter that?
So it would be just so oversimplified to tell patients, okay, just stand up straight instead of being art. It doesn't work. It's like telling someone, just relax. Like
when they're anxious.
Yeah, right, exactly. It just doesn't work.
It's okay. Like, I'm dealing with crippling debt. Just pay your bills.
Yes.
I would have if I could have.
So I work on first getting patients like aware that they're doing that and how nice it feels to be out of that.
Yeah.
So I'll tell my patients like, okay, tuck your bum underneath you. You're going to feel like it's real dumpy. Like it feels like this, but I'll have them look in the mirror is helpful too. And then they can tell that it's just straight up and down. Yeah. So kind of do some like standing cat camels a little bit to see what both of those feel like and then find the like neutral position in that. Yeah. So that's one for posture. And then the other thing too is there are muscles in that system that are weak then that we need to strengthen up. Because if we only work on loosening up the tight stuff, like it's going to come right back. Yeah. So that's where I'm giving out like rehab exercises for muscles that need to pick up the slack a little bit and then giving like stretches out for the muscles that are tight.
Yeah. Okay. Yep. So there's something that I want to talk about with hips also that I think you'd be really helpful for. So this is, again, a super simplification of pelvis and then the joint where the femur, right?
Yes.
Is coming into that. with a color other than red, something dark like black or whatever. Could you give us an idea of how muscles, tendons, and ligaments are attaching across these joints?
Yeah, so that hip flexor is made up of multiple muscles, and I won't go into like all of them that there are, but even if you draw like a little spine on top of
Yeah,
here,
sure.
they're attaching from the hip flexor is the only muscle that attaches to the front of your low back spine. So it's here and then it goes down to part of your hip. So it crosses multiple joints in that area. And that's why that front of that can be like, it's a stabilizer, meaning like when that thing is locked in, like it's preventing at extra motion, or it's trying to control that area a little bit more. So that's why that can get tight. But hip flexor is basically low back spine down to the hip itself.
Okay.
Is the main one. And then IT band stems from like knee, if we have knee down here.
Yep.
And then that attaches up to the hip and into the pelvis a little bit. So this little triangle here on the tippy top of your IT band is something that can like be compensating and get tight and really irritated too. And some patients will think that they've got like bursitis in here, and it's not. I'm not saying like bursitis isn't a thing, but when I'm seeing it, it's more typical, at least in patients that I see, that it's actually the muscle there that's like trying to overcompensate for everything. And then they're getting hip pain on that outside part.
But you're saying that hip pain and that potential bursitis could actually be because it's a knee thing?
Yeah, it could be.
Okay.
It could be like a myriad of things, right? So I'll typically like work on loosening up this muscle, either with like needling, cupping, like whatever I'm going to do to loosen that up. But I'm not only focused here. So each patient's a little bit different. It could be a knee, it could be a foot thing, could be a low back thing, pelvis, hip itself. Like that's where we got to dive in and like do a little work, do a little digging to see what the actual issue is.
So there's a bunch going on there. That's the hip might just be where we're getting the talk back.
Yes.
Because you said this is the front of the spine where it attaches?
Correct.
And it's the only thing that's doing that?
It's the only muscle that attaches to the front of your low back spine.
Yeah, gotcha.
Yep.
So I'm thinking back to when you drew the picture of the heel and the knee and how that's connected all the way through to the toes.
Yes.
It sounds like something similar here where it's connecting way past a single joint.
Exactly right. Okay. Yes.
So you might have the symptom here.
Yep.
But it's because of something happening over here.
Yes, exactly. So another symptom that I'll have patients come in with is like low back pain. And it's because this is really tight and irritated, or hip isn't moving well. So the like ouch is happening right here, but maybe like the issue itself is happening like down in the hip joint or somewhere else, kind of a thing. Yeah. So one of my mentors would say, and I stick with this to this day, is like take a look, touch patients where it hurts. So we know that they're listening, but like treat them where they need it. So I will go through with patients and say, okay, I know I'm not doing a lot of like hands-on stuff to the area that you're hurting at, but I'm still treating this. And this is still like, this is more the source of your issue, even though you're feeling it somewhere else. Yeah. And I'm sure that's really similar with,
And it's one of my favorite things I was ever taught by Dr. Freddie and by Dr. Lori. They would say, if a person comes in and says, I have a rash here, I have a pain here, I have a sensation here, you muscle test that area first.
Yes.
And it doesn't even have to muscle test poorly.
Yeah.
You just make sure that that client or that patient knows that you heard when they said the rash is there.
Yep.
And then you go and you find out where's the origination of all this trouble.
Exactly right. Yes. And the origination could be there.
Oh, totally.
But it's important to like look at someone as an entire like functioning human system.
I can't tell you how often people come in and say they have tightness where their diaphragm is.
Yeah.
And then I just check their gallbladder, and their gallbladder is the underlying issue, but the sensation goes way past the perimeter of the gallbladder.
Yes.
Well, they're probably all in the same nerve.
Yeah.
They're close enough that they're bothering each other, but we test across where they're feeling it. But then I'm still like, but is there just like one thing that's really futzing with it? It's often the gallbladder.
And gallbladder is interesting for referral into pain areas when I get shoulder blade patients. And it's not like when I'm poking around on muscles, joints in there, and nothing's like nothing's irritated in where they're feeling the pain, gallbladder refers to shoulder blade too.
Do you ever notice it messes with the right scapula more than the
Yes.
left? Yeah,
Yes.
I see that a lot too.
It's like heart. Like if you have a heart attack, it's left.
Left
like
arm
even
is
though
the
your
pain,
heart's
isn't it?
pretty set. So organs they have interesting referral patterns that way.
I see that also with, so like pancreas exists more on the left side of the body, spleen only on the left side of the body.
Yep.
I'll see them futz with left side of the body,
Yes.
but not the right side.
Yeah.
Yeah.
It's interesting.
Yeah.
Yep.
I'm glad you see that too.
Yeah.
Did a question roll in?
Not on this topic, but
Ooh.
Drew, while you erased the board at the fun question for Dr. Moira.
Okay.
From Rescue Mama.
Yes.
She would like to know, what is Dr. Moira's favorite challenge to help people with?
Ooh. My favorite challenge to help people with, I'll do like an overarching one and then I'll do a particular one. So I love when patients come in with a particular like function or activity of just their daily life that they're having trouble with. So yeah, they're coming in to see me with X pain here or this or that, but maybe it's, okay, I can't get on and off of the floor easy to like play with my kids. It hurts. I can't bend over and put my socks and shoes on in the morning. Those like little kind of dinky things that I find out in the, when people come to see me, getting people back to doing those and not having to think about them is my favorite thing ever. Cause that's every day. Like that's quality of life stuff. Yeah. That's my most favorite by far.
Putting on the shoes, I think of all the time.
Yes.
Because if that's difficult or you can't do it or causes some pain, how many times a day are you on and off of shoes? It could be a bunch of times. And then how many times a day are you not looking forward to something?
Yes, or you're avoiding it, or you wear your flip flops in the winter because that's when you can't bend over, like that stuff. Yes, that's my favorite. Yeah.
So like, no, because it was bad, and 5 times a day you want me to intentionally engage, and this feels bad.
Yes.
And they're like, no, I'm going to find a way around it.
Yes.
Slip-ons.
Yep.
Or whatever.
Yes, exactly. Yeah. Yep.
Good question.
Yes, thank you for asking that.
All right, so we did hip. All right, neck and low back. If you jot those up there.
Mm-hmm.
The way you said it, to me, it sounded like when the neck is off, you expect the low back to be off, or maybe when the low back is off, you expect neck to be off. But is that true?
It kind of goes back to everything is connected to everything else. Okay. So it's another thing if someone comes in, and they're only in with one of these issues, I'm checking like their entire body. But I would more say that I think people associate chiropractors with neck and low back first. So that's typically what I'm seeing with people to start. And they're like, oh, you work on feet? Oh my God, you do hips, you do wrists, you work on headaches, that kind of stuff. Yeah. But yeah, they do play into each other for sure. Okay. Yes. Mm-hmm. Okay. Yep.
A little while ago, I was taught that I believe it's the lumbar region of the spine, so the lower part, like near our belt line.
Yes.
Is not designed to rotate, but the rest of the spine is designed piece to piece to rotate.
Yes.
That's correct?
Yep.
Cool, I was taught well.
Yeah.
Okay. What can happen in that low back, in these parts that aren't designed to rotate, if they're trying to or if they're being made to?
So the best thing that I see with this is if our mid-back, like in between our shoulder blades, is not moving well, there's a lot of rotation that should happen there.
Okay.
If that is stiff and not moving as well as it should, your body is going to find a way to move no matter what. So then it's going to ask your low back probably, and your neck too, but your low back to rotate. And just the way that those vertebrae are designed, they don't have a whole lot of rotation in them. So then that's when people start to come in and they're like, my low back is killing me. My muscles are tight. Yeah. When I go to twist and reach over and have the kids quit barking at each other in the back of the car, whatever it is, I feel it there. So that's another thing, like, okay, you're feeling it in your low back. And it's not even necessarily that I need to improve the rotation in their lumbar or their low back.
Okay.
I need to improve the movement in their mid back.
Yeah.
So same thing, like people are a puzzle. It's looking at these typical patterns that people present with, but getting to like the source of the issue at the end of the day.
Yeah.
Yes.
So again, the symptom is in area A.
Yep.
The cause can be in B through Z.
Yes.
Yeah.
So for that case, like a typical general case of that, I'll loosen up muscles in the low back because those things are barking mad. Like they hurt, they're irritated, they're overworked, they're sore. And then I'm going to go in and typically adjust the mid back, especially to get that guy moving a little bit better, and then send home some exercises to do to like get out of that even quicker.
Okay.
Yeah.
So in low back, there's a certain group I want to make sure that we address. It's guys in their prostate.
Yes.
So I see this big correlation between guys who are starting to have prostate issues and the low back isn't moving and sending info the right way.
Yeah. Yep.
The nerves for the prostate come off of that part of the back.
They come off of low back and they come off of sacrum, which is like the little keystone like piece. So it's coccyx, your tailbone, then your sacrum, and then low back. So that same area. And for prostate cancer, like the first area that if that ever spreads or metastasizes is to spine and low back. So those areas are super connected, just like you're saying. Yes.
Okay.
Yep.
Now in the neck for anybody, again, thyroid comes up a lot of the time. If you jot thyroid up there for me.
Yep, for sure.
And then lungs.
Yeah, interesting.
So my people who have a big history of allergies or breathing problems, I see again and again, they're saying, and my neck doesn't feel right.
Yeah.
Or I go to my chiropractor and they are constantly trying to align my neck.
Yep.
I also hear a lot about first ribs being out.
Yes.
Okay, with my lung people.
Yeah.
Okay.
Yep. So maybe to draw first rib, we think of our ribs just like around our rib cage, but they actually do start up kind of almost at your neck. So if you're looking at this patient from the back, okay, and then this is their arms, this is the rest of them here.
Again, this is exactly if you opened a cadaver, what? I'm sorry, go ahead.
Your neck is longer than your legs are. This is how it is, okay? So
how do you sit in a car? And I have questions.
Yes.
It's all convertibles.
Exactly. So your first ribs are kind of at this junction area of like where your neck vertebrae and then your mid back vertebrae meet, and they live off just that junction there. So they are at the base of your neck, those first ribs.
Okay.
I see lungs involved in this in breathing mechanics. So patients that are chest breathers, which honestly is most of us, like we're kind of taught to like suck gut in, or women be like as thin belly as possible, whatever. And you've got to expand your lungs somehow. So instead of through diaphragm, which is actually belly movement, then we'll get it through lungs and almost shoulder. So I'll really over exaggerate this, but a breath in with someone that's a chest breather will look like, so they're moving these all day long. Exactly. And then these muscles get like mad, angry up in your neck and then kind of down your arms too.
How many times a day are you breathing and you're doing a shoulder shrug with each one of those?
Yes.
Those muscles are going to get exhausted.
Exactly right. And I think people are surprised, like we're working on breathing. Like I know how to breathe. Like
I've been doing it my whole life.
I know what I'm doing.
Right.
But because you see a lot of animals, a lot of pets, doggos especially.
Yeah.
So I tell patients, look at your pets or look at your babies. They are breathing through belly all day long because they don't care what it looks like. Yeah. We're the ones that have changed this over time. Yeah. So then they're like, oh my gosh, yeah, you're right. And you actually get 30% more lung capacity when you breathe with your diaphragm. Yeah. It's how we're supposed to breathe. Yeah. So getting that changed with people can be like a big source of relieving this, that like it keeps coming back. Well, the source may be like as simple as how we're breathing.
Yeah.
Yeah.
Instead of doing 1,000 shoulder shrugs every 3 hours, right?
Exactly. Yes.
Yeah. Okay. Okay, cool. All right, the next on the list is headache. I want to check if questions rolled in. No. Okay. I really enjoy working on headaches.
Yeah.
Because I enjoy the system I have for headaches.
I would love to hear it.
Thank you. I would like to talk about it.
Yes.
That worked out. Okay. So headaches. There are all these different areas that I'm thinking about. So there's frontal lobe, so that's your forehead. Mm-hmm. There's what I call top of head. I'll let you guess where that is. Then there's the crown, which everybody on the cameras can see. It's this part. And then there is the cerebellum, or the base of the skull. Okay. So for the most part, when somebody comes in and says, Drew, I'm dealing with headaches, or I want help with headaches, I'm looking for a product that will support me in getting rid of these headaches, I'm saying, where does your head ache? And I don't think people are used to hearing that question. They just think like headache, my head aches. And I'm
Yeah.
like, well, no, but is it hitting you here? Does it hit you in the temples? Is it at the base of your head? That picture you just drew with the 1,000 shoulder shrugs from too much
Yes.
breathing.
Yep.
Most like base of skull or cerebellum headaches, it's because all of that back there is lit up.
Yes.
Am I correct? The muscles from our neck go all, like that high on our skull?
Yes. So if you stay back here, so upper traps is something that I see that's tight on a lot of people, and that's a big, your trapezius muscle is a big triangle. So it goes from the base, just like what you were saying, the base of your skull, down your back, and then it comes out to the tip of the shoulder and back up. So the upper piece of this, when that's tight on people, it attaches all the way in at the base, but through fascia, just like that plantar fasciitis that we were talking about, it actually wraps all the way into the forehead. So same thing. If it's tight in one of those areas, you can be feeling the discomfort somewhere else.
Yeah.
Yes. Yep.
So I want to know where in the head it's hurting, because that's just going to help me narrow down what we have to do about it.
Same. That's my first, it's like the hip. It's the first question. Like, I have a headache. Okay. There's a lot of little spots in your head though, where it can be coming from. And that is important as to what type, what the source is, all that kind of stuff. Yes.
So you started drawing pictures. I'm super curious.
So this is the back of your head. And then if you can't tell by the beautiful face, this is the front. Yeah. Go for
Reminds
it.
me of the Nickelodeon show with Doug.
Oh my gosh. Yeah.
That's very Doug-esque.
Yes.
All right, so frontal lobe, what I see again and again when people are having headaches there is they usually just have a hungry brain, or they have been breathing something that's really noxious or bad for them through their nose. Because when they're breathing in right there, the sinus cavities, it's really easy for things to pass into our bloodstream from our sinus cavities and then affect some of the closest tissue, which is this frontal lobe part of our brain. Now, I'm curious, when you have frontal lobe people dealing with headaches up front, do you see the need to adjust face bones?
No, and that's something I would like to learn more about.
Okay.
So our face bones are interesting because they're not movable joints really. So it's a joint called a suture, and it's kind of exactly what it sounds like. They are where bones almost like come and fuse together.
Yeah.
There's not like movement in there like you would have in like a ball and socket joint or like a hinge joint, like a finger or your knee kind of a thing. So that doesn't mean that those areas can't be worked on, but they're not going to get like pops and cracks in your head kind of a deal. There's an interesting one with like your nose. You can insert like a balloon in there, pump it up really quick, and then that's like a nose. I'm not trained in that, but I feel like for allergy sufferers or like sinus headache, frontal headache, congestion people, that's interesting to me. I don't know enough about that to like comment on what like the best use of that is, but it's intriguing for sure.
To say the least.
Yeah.
Okay. The top of the head.
Yes.
Our skull comes together, right?
Yep.
Is that suture again?
I believe that is a suture. They match up with the lobes of your brain. So I think parietal is a little bit more in like the back here, but I'd have to go back and look at my anatomy books for sure to know what the suture line is up on the top there.
Gotcha. Okay.
Yeah.
When I see top of the head, a lot of the time, I'm seeing again that it's a really hungry brain, but I'm also seeing the need for good iron in the brain.
Interesting.
To help the two hemispheres communicate better.
Yeah.
So a lot of people get toxic iron. We need to have good iron. We need to have good iron to help the two hemispheres of the brain communicate with each other. Standard Process has a product called Catalin with iron that was developed for that very thing, to make sure that each half of the brain is sending info back and forth.
Yep. Sometimes I will get patients that are taking in a lot of information, like a student or someone at a new job or like people in mental health therapy.
Okay.
And like the front and the top of their head is where they're feeling, I wouldn't say it's a typical headache, but like tingling almost sometimes, or like it's being used. So I would say brain work, just like you said, like hungry brain, it's being used and you're thinking a lot. That's where a lot of your top tier level thinking is frontal, is in those areas. So that's
Gotcha.
not something that I'm treating, but like that's another interesting thing. Like,
Yeah.
Yep.
I'm realizing I should have written sinus here because that's
Oh, yes.
such a common part.
Do you find people that get actual sinus headaches too, though?
Yeah.
Where it is in like their maxillary sinus
Yeah.
for the most part, or like in between their eyes almost?
Even with like some mastoid stuff.
Yeah.
And mastoid stuff, that's the like back by the ears and the jaw.
Yep.
Yeah.
And your lymph nodes like live back in there too, so that makes sense, right? When those get like irritated.
Or if they get slow and then things start to literally fill up because the head is trying to use lymph tissue to drain certain things or mobilize certain things. But if it gets stuck here, stuff starts to back up in the head.
Yeah.
Yeah.
And then another interesting one with like the back of the ears,
Yeah.
there's a big muscle in your neck called your SCM, sternocleidomastoid, and it attaches in here and then goes into like that knobby point at the behind your ear. So sometimes that like attachment can be tender and sore, and that can be muscle sometimes as well. Yeah.
Gotcha.
Mhm.
Crown is something that I'm typically referring, if they aren't already seeing a chiropractor, I'm saying this should really be a part of it.
Yeah.
Because I almost always see that it's the cerebrospinal fluid.
Interesting.
When the crown, and a separate thing, especially the fellas, if you are losing hair at your crown, this back part, again and again, I see that people need nourishment for that part of the brain specifically.
Yeah. And where are you seeing that in the crown? Is that like off to one side versus the other? Is that
It's
kind of the
usually
whole thing?
right up Main Street.
Yeah. Yep. Okay. So I will see that sometimes with like true migraine symptoms, it's off to like one side of the head. And there's also really interesting referral pattern of some back of your neck muscles that it's right on one side typically. And I'm like, okay, I'll push on this. Or like, oh my gosh, that makes my headache like throb. So I'm not touching anywhere where they're feeling it, but they're like, oh, whatever that spot is like the source of it. Yeah. Headaches may be one of the most clear like referral pattern things for people. They're like, oh my gosh, yeah, you're pushing on somewhere totally different than where I'm feeling it, and I can feel like it's worse when you push on there. This must be an area that we need to work on.
Gotcha.
Yep.
Okay. Something that's interesting to note is that the brain being the most complex thing in the known universe, at least according to NASA, the nutrients we use to handle frontal lobe and top of head and even base of skull things are what's known as alkaline. So it's things like most forms of calcium, for example, are alkaline. The nutrients that tend to benefit the crown the most are very acidic in nature. They are the opposite of alkaline. If alkaline is white, acid is black. If one is up, the other is down. Okay. But I don't see other parts of the brain test for those acidifying nutrients. And often in a lot of natural circles, acidifying is deemed a bad thing. But please keep in mind there are certain parts of your body that are really supposed to be acidic.
Right.
Like your stomach acid.
Yes.
Hence the name stomach acid. But I've also found that cerebrospinal fluid benefits from giving the acidifying nutrients.
Interesting. I will say with headaches where if they're not, it's called cervicogenic. So if they're not like neck muscle like related, or I get them 50% better, but they're still there. That's when then I'm referring to someone like Drew. Okay, there's something else going on here. We're working on everything in the musculoskeletal system that we should be, and it's not clearing up. Headaches are probably the most commonly like we need multiple team members on them if we're not getting like good relief in a normal amount of time, which I would say a normal amount of time would be like 4 to 6 weeks under care.
That's pretty quick.
Yeah.
Especially since some of these people come in and it's been years that
oh my gosh, yes. So I'm not saying they'll be fixed in 4 to 6 weeks, but if we're not getting anywhere or we're like 20% better in 4 to 6 weeks, there's some other factor that's going on with this. Yeah.
I'm referring out to chiropractors on this one because I want to make sure that all those joints are moving and not hanging up that fluid from its ability to move around like it's supposed to.
Yes.
Cerebrospinal fluid, as far as I've been taught, it's supposed to cycle from top to
Yes.
bottom.
Yep, it
Yeah?
does.
Okay,
Mhm.
cool. Does it have a pump like our heart pumps our blood? Or is it just relying on not being impinged?
That's such a good question. You're really bringing me back to like neuroanatomy right now.
Mhm.
I
Woo!
believe it's like our lymphatic system
Yeah.
where there's not, and correct me if I'm wrong on this, but I believe it's like our lymphatic system where we have like a tube basically that
Mhm.
encases all that, but there's not a heart that's pumping it.
Right.
It's body movement.
Yep.
Like it's us moving around that is pumping that.
That's why often for lymph stuff they say bounce on a trampoline because
Yeah.
that shakes that fluid because there's no pump for it.
Exactly right.
Now I've also
Yes.
heard people say with the cerebrospinal fluid, the trampoline stuff,
Yeah.
the jump roping, even
Dry brushing.
all this stuff. So
Yeah.
you're pumping it because it doesn't have a pump.
Exactly. Calf raises if you have like foot smell. Yes.
Yeah.
So lymph, getting off on like a side tangent here. Lymph is just like what blood vessels would be, but again, there's no pump to it, but
Right.
they do have valves to try and like prevent pooling.
Yeah.
Just like,
Backflow.
yeah, otherwise it would just, our feet would be like swollen like crazy.
Gravity would kick in.
Exactly. So those valves help us with that. But if we have patients with like lymphedema or swelling,
Yeah.
that's removing the trampoline stuff, that dry brushing, lymphatic drainage massage will help like aid in that. Yeah.
Wonderful.
Yes.
That was our list.
Yeah.
Wow.
We got to talk base of the skull. I'm interested
sorry.
in what you find
Yes.
with this, because this is probably the most, maybe not the most common headache location wise, but this is where the most common like problem that I'm actually working on in headache is. Yeah.
So the base of the skull, I see a lot of the muscular related issues. I see again and again that there is this huge magnesium need. And I'm a fan of using magnesium even topically sometimes.
Interesting.
So eating foods that are rich in magnesium like buckwheat and Swiss chard, that's a great idea. I often find the amount of those foods we have to eat to actually get adequate magnesium, since when we eat magnesium or supplement with magnesium, head to toes, our body is divvying up that magnesium. But if we can take a topical magnesium like a cream, then we can apply it directly to the area. We know it'll pass in through the skin, and the muscle is sitting right underneath there.
Yes.
And then have some kind of activity, some kind of action acutely at those muscles.
Okay. And I literally just had a patient in today. It wasn't for headaches, but he was recommended a magnesium supplement that he applied to the bottom of his feet.
Yes.
Tell me your thoughts on this, but from what I have learned, that is like we absorb so well through the bottom of our feet.
It's pretty wild.
Yes.
And it's not, we do have to be a little bit picky about that because it's becoming more popular and more mainstream.
Yeah.
More people are knowing it. So, of course, there will be people making products that are cutting corners.
Yes.
Certain forms of magnesium are easier to pass through the skin than other forms. So, we want to avoid things like magnesium oxide because it's pretty junky.
Okay.
Yeah.
Yep.
Yeah, it'll pass in through the bottom of the feet, so you can put that on at night to help you rest a little bit better. For example.
Yeah. Cool. Magnesium is, from my just base knowledge, like one of a handful that like every American human should probably be on a supplementation for magnesium.
So many people need it.
Yes.
We do the hair tissue mineral analysis on it, HTMA, hair tissue mineral analysis on it, because people need it.
Yeah.
But what I've seen again and again is that if there is an ideal level for their magnesium, that dashed line, that's how tall the magnesium level should be in the body, is sometimes they are deficient, which means we just need to give them more.
Yep.
What also comes up all the time is that they are way above the ideal level because their body is getting magnesium but doesn't know what to do with it. The symptoms of either one of those can be identical.
Interesting.
So I agree that most people need magnesium. We do the hair tissue mineral analysis to see if they need more magnesium because they don't take in enough, or if they need magnesium to be aided in the body in terms of absorption.
I love it. And this just goes back to what we've been cycling back and forth on is like, okay, we can maybe know what the source of the issue is, but like, how are we going to go about it? So being specific, doing testing for it, having someone that has a great knowledge base of this kind of stuff is of the utmost importance. Because then I'll get patients and like, oh no, I've already been to chiropractor, it hasn't helped, or I've been to this or that, the other thing. Like, the general approach can help out like, you know, X percentage of people, but the specific one is where you're really going to get to the nitty gritty and get people like the sustained like issue fixed. Yeah.
For a
That's
long
awesome.
time around here, we've said, don't guess, just test.
Yes.
There's so many ways to test things. So if you've tried a test to figure out a problem and you haven't found the solution, good news. There's 80 gajillion other tests. So sometimes it's a matter of finding the test.
Yep.
They're like, oh, and that's what's off. Now I can fix it.
Yes. Yep. Beautiful. And then do you like audit? So it's not like you're taking a hair tissue sample every time a patient's in,
Right.
but you're testing stuff every time they're in. And I'm the same way. Because if we're not rechecking what the improvement is, or if people have had setbacks, or if they're staying the same, then how do we know if we're doing the right thing for that patient or the client?
I'm thinking about your people. If you give them the exercise to strengthen an area that's weak and causing a problem,
Yep.
and they are super compliant. They're doing it. You said 3 times a week, and they're 3 times a week locked in. If they just indefinitely did that, isn't there a potential they could over-strengthen that area and create a new issue?
There is a potential for that, and each patient's a little bit different, which is why when patients kind of graduate, so they're out of like this specific issue, and then hopefully they're at the point where they're at a fork in the road. They either come in next time they need something, or we get them. I'm always suggesting maintenance care for patients. They're not under some like contract they can't ever get out of. You don't have to pay, you know, whatever up front for it. Like, but that will kind of keep you resilient. And with that, I'm giving patients out exercises that are maybe more a little bit general, or maybe full body focused, that are, it's like brushing your teeth for your body. Like it's something that we just do on a routine, and it's helpful for us, and it's great for their mobility, movement, and like muscle and joint health. I'm sure that's probably similar to what you're
thing.
Yeah.
Because if the person came in with low magnesium and I walked them out the door with magnesium and said, just take this forever, eventually the correct source of magnesium based on their hair tissue mineral analysis should correct that, which means now we're changing dose. Now we're looking at these other things.
Exactly.
It's not just, I mean, I wish it was, but humans are too complex to just say, that was good for 2 weeks, just keep it the same forever, it'll always work.
Yes.
That's not how it goes.
Well, it's the same thing. Like, okay, you're coming in to see me 2, sometimes 3 times a week if a patient is like in pretty rough shape, or we got a big hole to like dig ourselves out of. I'm not seeing them for 2 to 3 times a week for the rest of their lives because it like worked after a little while. Or I'm not needling a patient every single time. Like we're switching it up with what their body's telling me, like what their improvement or setback is. Yeah.
Like it.
Yeah. Cool.
Did questions roll
One
in?
question rolled in here from NTP33.
Okay.
The question is, what's the best gut test? How do you fix gut?
Ooh, that's a really good question.
Yes.
Could you erase a little bit for us?
Absolutely.
And I don't have a mic on, so I hope people can hear
Yes,
that
sorry,
question.
I will be to Lori what the Lorax was to the trees, because Lori doesn't have a microphone, so I will speak on her behalf. The question that's rolling in the chat is, what's a really good gut test to understand its function? How do you help a gut? Yeah. So there's a bunch to that. First, we have to talk about tennis. Do you know why we have to talk about tennis?
I would love to find out.
I think it's an analogy time here.
There's this incredible book called Gaps, Gut and Psychology Syndrome. The author of that book is a rather brilliant person, has a master's degree in neuroscience, and started to study the connection between the brain, physiology or psychology, and the gut. So what was going on with the gut was affecting these people's brains. And Natasha figured out so many things about how to help the gut, and in doing so, you help the brain. Talking about things like autism, schizophrenia, depression, anxiety, some very common brain-related issues. Okay, in that book, which I recommend you read, only a couple of pages at a time. I think I said this one in the last few weeks. Get the book; it's amazing, but please set a goal of like 2 or 3 pages a day at the most. It's not Harry Potter. It's not Harry Potter. She explains all the nooks and crannies inside of our intestines. If you unfolded all of those, you could cover half a tennis court with it. Half a tennis court with that. So Google how big that is, how many square feet that is, and it's sitting right here inside of us. So to heal a gut, it's very complex. There's a lot going on with it. There's fun ideas. The digestive tract is the only system in the body that has an opening at either end of the body. All of our airways, it's mouth, nose, ears. That's all right here, right? There's no other system in the body that has an input and an output elsewhere. Pretty unique.
Yeah.
Okay. Again, it's just complex. It has different rules than other parts of the body. On top of the closest supplement bookcase is the biome test from Standard Process. There's some really fancy tests out there. So if we're going to talk about tests, oh, it's weird to write sideways. Made it work. There's so many tests, and there are so many really great tests. I am in favor of starting really simply. There is a stool sample test that we have here. Yeah, perfect. You can keep it closed. We're not going to take a sample on air. You're welcome. It's a microbiome test kit. Is that in focus on there?
I'm closer.
I'll get you next YouTube, I
Yeah,
promise.
that's good.
Good. Then would you check for all our YouTubeites?
Yep.
Cool. This is a test that you can do at home. It's pretty basic compared to some of the fanciest of the fancy tests. But the reason that I like that so much is if you aren't doing the basics, should you even be looking at the fancy stuff? No, you shouldn't. You got to put the basics in first. You don't run a marathon just because you bought a new pair of shoes. It's because you like put these things in place to prepare your body for it. So I like that test because you get to do it in the privacy of your own home. And it comes with information about here's what was found in terms of good bacteria, bad bacteria, different types of waste product that'll be in there. Believe it or not all poop is created equally. So we want to know what type of waste your body is making the most of, the least of, maybe too much of, or not enough of. That tells us about what nutrients we may have to apply to help out that complex half a tennis court. So in terms of what helps a gut, that would be a 2-hour presentation.
Oh my
just to
gosh,
scratch
easily. Yes.
surface. A better idea is to say, let's analyze you as an individual and then talk about those things that we're seeing your body needs.
Yeah. And to add one like this is not by any means the area of my expertise, but I remember going through anatomy and developmental, like anatomy and physiology.
Yeah.
Our digestive tract is like the first thing that gets formed when we like after conception.
Yeah.
So it's that tube, right? So if that tells you how important that is in your body, like it's the penultimate of importance.
Yeah.
Yes.
Yeah.
Yep.
I default to saying Spanish black radish by Standard Process because I want everybody on Spanish black radish. It's so good for your tummy. But if you did this microbiome test kit with us and it came back that Spanish black radish wasn't appropriate for you, I would forego it. That's how important this tummy stuff is.
Yeah.
Yeah. I hope that answered your question. Did other questions roll on?
Yeah, this person asked another one. Do we all have parasites?
Do we all have parasites?
That's a really good question.
Yeah, I like the question, but I know that not everybody has the same stuff going on. How to keep it simple. So on the topic of parasites, sorry, I'm bumping you right off.
No,
the
you're
stage,
good. This is your
parasites. There are multiple categories. And the reason that's so important is size. There are parasites that you can see with the naked eye. So when you hear people talk about things like tapeworms and flatworms, if a tapeworm you can just see. But then there are some parasites that are so small they're microscopic. So you could be dealing with a parasitic issue and never see anything that looks like a parasite, but it's still parasitic in nature. The likelihood of everybody having some kind of parasite is incredibly high, even just in the gut. because it's a half a tennis court worth of space for something to find a little nook and cranny and hide away in there long term. There's all sorts of foods we can eat on a regular basis. It's usually the sulfur-rich stuff. So to fight back, we're going to use sulfur-rich stuff. So that's going to be your garlic, your radishes. And I wish someone would talk about using radish more often. Onion, those sulfur-rich foods are really good at helping the body deal with any category of size when it comes to parasites and helping the intestines to clean themselves out. In general, we want the gut to be really nourished up because so much of our immune system lives in the gut that even if you have a microscopic parasitic issue outside of your gut, like let's say on your skin, we still want the gut to be really well nourished and functioning because of how much of our immune system lives in the gut to help us deal with the parasites wherever they are in the body. Which goes back to us talking about the mid back might get adjusted so that the low back doesn't have to do the work.
Yes, right. Yep.
MTEMP has another question coming in. How important do you think going to a biological dentist is?
For me, the utmost. There's a lot of stuff that you can use to clean teeth or use to shape teeth or to reform them, but it doesn't mean that they're the right stuff for your individual chemistry. So what a lot of biologic dentists do that I really appreciate is they will have options for things like crowns, fillings, implants, and they'll do some form of testing to make sure the materials being used on your case are appropriate for your individual chemistry. That is something that I don't see happens a lot with non-biological dentists. It tends to be more of the one-size-fits-all approach, which, as we just said a few minutes ago, really opposed to one-size-fits-all.
All right, and then NTEMP has another question.
Nice. NTEMP's on fire.
Yeah.
When do you think someone should get a food sensitivity test?
Ooh. So a food sensitivity test might restrict us in what we're eating. So first I got to make sure the person is in a good headspace for that. They have to be ready to be told that even something we expect is nourishing, like green beans, this is a true story, would have to get withdrawn.
Yep.
A client came to me from a different nutritionist across town. They said, you need to increase your veggie intake. She only liked green beans when it came to vegetables. So she started to eat green beans twice a day because she was willing to.
Yep.
But if you eat the same thing day in, day out, especially in high volume, it's very likely your body is going to start to get bothered by that. Lo and behold, when this client did a food sensitivity test, green beans are one of the biggest offenders. And she was like, but it's a vegetable. How could it be bad for me? So before we do food sensitivity testing, you have to be mentally in the space where you're prepared to hear that something as nourishing as a green bean could be something you have to start avoiding. I also like the idea of the microbiome test way before that, because if the gut isn't set up to digest food correctly, I expect that any food could become an offender. Does that idea make sense?
Yes, I've heard this too, where
Okay.
if just like what Drew's saying, if we do a food sensitivity first, maybe instead of finding out what some of the basics are, you're going to come back and you're not going to be able to eat anything. And it's like, what the heck? All I can have is water and
Ice cubes.
yeah, right, exactly. So it's not those foods that are like highly sensitive to your body. It's that your gut is pissed off right now.
Yeah, it's all jazzed up, and now we got to do something.
Yes.
Yeah. Otherwise, most foods are going to come back as offenders.
Exactly. Your green bean story reminds me of a patient that I had. He would come in probably twice a year. He would get on these kicks of doing like push-up challenges or pull-up challenges. So he'd be doing hundreds a day, and he'd come in with issues that was from repetitive, too much of a good thing, right? Yeah. So yes, there is a limit to pretty much anything. If that's the only thing, or we're doing it excessively, like it can turn out some not so good results.
It can backfire on us.
Yes, exactly. Yeah. Yep.
I just want to give you a time check. It's 8:05 p.m.
Oh.
Didn't know if you want to take more questions or not.
Y'all hung in. Let's do one more question if it's in there. But okay. Over an hour, y'all hung in there. Way to go. I'm impressed.
Right. We do have one more question. question then.
Okay, hit us with it.
Has to do with allergies.
Yeah, let's
How do
talk
al-
allergies.
Derek, how do
Yeah.
allergies form, and what do you do to address them?
Allergies is almost as big of a question as the gut, I feel like,
Yeah.
for an
Yeah,
overarching.
potentially.
Yes.
And I'm thinking it goes back to headaches in my brain right away.
Yeah.
Because I'm like, yeah, allergies mess with your head a bunch. So
You see, can you fix the body from having that sensitivity versus just
Ooh.
helping it to cope with it and deal with the symptoms, I guess?
all right, so an allergen is what causes allergies. I want to use a different word for it. I want to use the word irritant. Something that bothers your body. For some people, that's dust mites. For other people, that can be food, and all sorts of things in between. We just need to understand that allergies are the outcome of something irritating your body. One of the biggest issues related to all of that is histamines. We've spoken about this on the live stream before. Histamines need to be readily cleared from our body. If you've taken Benadryl, you've taken an antihistamine. Fortunately, you don't have to take Benadryl to clear histamines if you take care of the part of your body that was designed to deal with histamines, and that would be your liver. You have got to love your liver. You can feed your liver Antranex by standard process. It is a natural antihistamine. It's one of the best things you can take for that. Allergies or irritants can start to come into our system through a lot of different ways. We could touch it, we could breathe it, we could eat it. All of those, what they have in common is that ultimately, if it starts to irritate our body, it comes back to the liver. So the way that we help people when they're dealing with allergies and allergy symptoms is I make sure that they have a well-nourished liver. I'm curious if you see anything consistent with allergies.
With allergies, I will get lymph buildup
Okay.
as well. So it kind of depends on what allergies. I'm always referring out to nutritionist, naturopath, functional medicine, exactly what Drew does, because that is much more in their realm of getting to those basic sources of the issue. I can help with like getting all that stuff like flushed out of your body. It's not going to be as good of a fix of like getting your liver working well, avoiding the irritant, all that kind of stuff. But when patients come to me with allergies, they might be having that sinus pressure headache. Okay, I might be able to relieve some of that swelling that's built up in there. But if we're not addressing like the source of why they have the allergy in the first place or how our body is really going to process it, they'll keep coming up. Yep.
There you go, Derek. Thank you for asking. Thank you for the questions and the engagement. Everybody, thank you to Dr. Moira for being here for this. For y'all that don't know, Dr. Moira has an office right off the classroom here. So if you are in search of very good chiropractic care, keep in mind that the initial consultation with Dr. Moira is free. You want to take a history and understand what's going on before you say, let's move forward.
Yeah, I want to see if it's a good fit for people. It's a no muss, no fuss, like see if we're a good fit for each other. So I'll have patients typically come in with questions. What do you typically do for this? Do you see this a lot? And I'll tell patients without an exam, I can't tell you for sure, but here's what I've done in the past for this. Here's how long a time range could typically take. Each person's individual. But that free consult is like the easiest way. Take me up on it. It's a great way to get started and see if we're going to be a good fit for each other, for me to help you out. Cause that's my goal at the end of the day is to help.
And then when you're in here seeing Dr. Moira, chances are I'll be around. And if you want to dork out, I'm here for that. We talk. We like to dork out about stuff. Yeah. Cool. We will be back next Wednesday. We got to have you back on here at some point also.
I'm here.
Okay, cool.
Yeah.
She'll be back. Y'all take care of yourselves. Thank you so much for engaging and for watching. We'll see you soon.